So in the last video, we discussed how poor breathing mechanics influence faulty rib and spine position, and thus potentially faulty joint position of really any joint throughout the kinetic chain, head to toe, and in turn will cause postural dysfunction and potentially joint pain. What I'm going to show you guys now is a drill, a really foundational, like a staple drill for reestablishing those breath mechanics and starting to hack posture and hack that chronic joint pain you've been dealing with. This was a game changer for myself personally, as well as many clients I've worked with. This would be useful. This should really be a staple for anyone, if I'm being honest. There's not anybody that couldn't use better breath mechanics, but obviously, as we discussed, especially if you're having any sort of joint issues, postural issues, really anywhere, but especially for those suffering low back pain. So, 90+% of adults at some point in their life will suffer low back pain. It can be debilitating to work, social relationships, really all aspects of life. And I know, it's no secret, many of us have heard it said that low back pain can be caused by stress, and a lot of people think that that's woo, so to speak, but hopefully if you followed along in the last video, you heard me establish a blueprint for basically a root cause of what's driving that low back pain from stress, which alters breathing mechanics, and then the dysfunctions that we see down the chain. So I'm going to take you into this exercise in just a moment. Like I said, not limited to low back pain, but I kind of cite low back pain because for those that are in low back pain, this can often be a game changer pretty quickly. Some people after just a couple rounds of it, but definitely after days to weeks of practicing and getting efficient at it. And again, all joint dysfunction can benefit from this, low back, but definitely not excluding, especially I would also cite neck pain, shoulder pain, hip pain, even knee pain, really anywhere. So this exercise we're going to get into is called a 90-90 hip lift, okay? I'm going to demonstrate it for you here. I'm going to kind of walk you through me doing it and kind of walk you through the cues of me doing it as best as I can. Then we'll recap at the end. Before we begin, just shout out credit where credit is due. This exercise was created by Ron Hruska and the Postural Restoration Institute, or PRI, a team of brilliant physical therapists who, I think about 15 or 20 years ago now, basically coined and made mainstream the theory that I shared with you in the last video that proves that breath mechanics influence posture globally, and this is a staple exercise that they use to help get folks out of pain and out of postural issues. So for the 90-90 hip lift, what you're going to do, really all you need is a wall, okay? I have a mat here I'm just laying on for comfort, and you need either a ball, a yoga block, a foam roller, like a half foam roller works, really anything that I can just kind of wedge here between my thighs and just gently squeeze to create a few inches between my knees. So what I'm going to do here, and again, before we begin, this exercise for many of you, and I imagine probably most of you that are watching this video, because you wouldn't be watching it if you weren't, for many people that tend to be like type A or go, or maybe you're high level athlete, maybe you're just a weekend warrior, this is going to feel very like low level. It's not supposed to be intense, it's not supposed to burn, it's not supposed to be taxing, right? It's actually the opposite. Remember from that last video, what we're trying to do is get you out of your sympathetic or your heightened stress response and into your parasympathetic nervous system. So we're trying to relax you. The best advice I can give for this is don't overthink it. If it feels like you're not doing enough, you're probably doing it right. I just want you to focus on breathing and relaxing, okay? I know for me, the learning curve was difficult at first because I was like, what am I supposed to be doing? So what we're gonna do here is we're gonna set up in what we call the 90-90 position, which is 90-degree angle at the knee, 90-degree angle at our hips, okay? We're gonna have those toes just facing straight upward, about shoulder width apart, all right? I'm going to take my ball, block, foam roller, whatever. I'm going to just wedge it between my thighs, all right? Now what I'm going to do here for this drill is I'm going to begin with a full audible, all of our exhalations, there's going to be a breathing drill. Remember, our exhalations are all going to be audible, so I want to hear it because we got to drive those ribs down, we got to get all the air out. So we're going to begin with a full exhalation. And as I exhale, what I'm going to do is I'm going to think about just slightly lifting just my tailbone while my low back stays flush, so just my tailbone and what we call a posterior pelvic tilt. very slightly as I gently squeeze the ball and gently drag, attempt to drag the wall down with my heels. So again, this is not volitional, it's very subtle squeeze, very subtle heel drag. Obviously we're not really dragging, it's isometric, we're just imagining we're dragging the wall down. You'll feel your adductors or your groin muscles and your hamstrings just very slightly engaged, that's all we want. Okay, so from there, kind of recap, big exhale, squeeze, drag, lift, just so there's a little daylight between your tailbone and the ground. From here, with that air out, okay, I'm gonna re-exhalate before I do this, but with that air out, and a soft abdomen, so the cue here is jelly belly, okay, so abdomen, outer abs off, soft stomach. I'm gonna have you breathe as slowly as you can, get an inhale through your nose, nice and low down into your groin, soft abs, okay? You're gonna aim for 4 seconds. Then you're gonna let your air go. Again, audibly, let your ribs fall, audibly, while you squeeze and accentuate that little drag with the wall, right? And you're gonna try and exhale that air out, again, keeping those abs soft for 8 seconds. Once the air is all out after 8 seconds, we're then going to pause with the air out for 4 seconds, so hold with the air out, and then we're gonna re-engage the cycle. So I'll take you through a few rounds. It sounds like a lot, but again, we're gonna make it simple. Here's what we're gonna do, ready? So I'm gonna exhale, gentle squeeze, gentle drag, just lift the tailbone, abs off, jelly belly, okay? We'll put a hand down low and a hand on your chest just to make sure we're drawing air. I'm gonna inhale 4 seconds through my nose, nice and low. And then let it go. Pause. Inhale again, nice and low. Exhale, 8 seconds. Squeezing, gently dragging. Abs soft, air out, 4 seconds. You hear me, my air's gone. Barely talk. Inhale again. Exhale, squeezing, dragging, audible. Let the ribs fall. Abs off. Inhale. Exhale. Pause. End with an inhale. All right. So let's recap here. We exhale our air out. We give that ball a gentle squeeze. We gently imagine we're dragging that wall down. This will gently, very subtly activate our groin and our hamstrings, keeping our abs soft. We're then going to inhale through our nose as lowly down into our groin as we can. 4 seconds is the goal. Then we're going to exhale audibly. Blow that air out, blow those ribs down, keeping the abs off. Gently squeezing and dragging. We're going to hold all the air out for another 4 seconds. And then we're going to repeat that cycle. Ideally, we want to get 4 rounds of this cycle, okay? If you can't exhale, a lot of people might have trouble inhaling and exhaling for 4 and 8 in the beginning. That's fine. If you can only get 2-3 seconds in on your inhale, no big deal. Just make your exhale twice as long. Whatever your inhale is, we want to shoot to have the exhale twice as long. If you are unable to get through 4 rounds, again, you might be struggling, like kind of gasping for air, that's okay. Go through a couple rounds to begin with, take a break, take a minute or 2, come back. You'll get better as you go. Best cues I can give for this are don't overdo it, don't overthink it. Really just think about keeping the abs soft, breathing as lowly as you can through your nose, and then really audibly exhaling that air out, letting those ribs fall. As you hold that out breath for those 4 seconds, each time you go to breathe back in, you'll feel that you can breathe deeper because we're getting that diaphragm moving like we discussed in the last video. So I always, people ask how often should I do this? Say good rule of thumb is definitely do at least a couple rounds of it, two to three rounds before your workout. Before is probably most important. After, if you can too, after is important as well. And then on off days as well, get it once or twice. If you're in some kind of acute pain, doing this twice a day, off days maybe morning and night, and then before and after workouts can really be a game changer. So give us a shot. This is the 90-90 hip lift. Let me know what you think. Like, share, subscribe if you find this helpful. Any questions, I'm always active in the comments. And we're going to keep this video series rolling on how to set you up for better breathing with our next video.